Welcome everybody. My name is Joe Moore. This is my cardiovascular video for my nurse prac program. So anyway, my name is Joe. I'm one of the nurse practitioner students here today. I'm going to be doing your exam. I checked your stuff out front at the front desk, and I see that you've signed your consent for your examination today. Is that correct?
Yes.
What do you go by?
Lisa?
All right, Lisa it is. You can call me Joe. And so there's our introduction. We always take our blood pressures out there too. And for this particular exam, we're going to take them lying and sitting. And so the blood pressures are appropriate. We're going to assume that. And we've got her consent. We're going to move right on down and start with the inspection portion of it. I'm going to do mine in a little bit different order than they do on the video, just because I'm a little more familiar with it that way. But I'm going to come in and do my visual inspection, because that's always first. And we're going to inspect the skin. I know she doesn't have a gown on, but we're just going to pretend. And so we're going to check the skin of the neck and of the upper torso, the arms and the legs. I'm going to do the whole inspection first. We're looking for bruising, scar tissue, any kind of lesion. And so we've checked her skin through her neck. We've checked on the thorax, anterior, abdominal. We've got the legs. Everything looks pretty good on the skin, all right? So for visual inspection, we've done that. We're going to come in here and inspect the hands, look for that tarring on the hands for a smoker. Even though she may have said that she doesn't smoke, we're going to look for the tar on the fingers anyway. But as I'm touching her skin, I can see that it's pink, warm, and dry. That's going to be part of it later on. Let me check this out. We're going to come back and do her pulses after a while. We're just looking for anything. Looking down here, everything looks good. There's no lesions or anything. So the inspection is okay. Now we're going to have her turn her head to her left side. We're going to do the jugular venous pressure. Excuse me. Sorry, I should have finished that. Jugular venous pressure, JVP. I see it right there. All right. Makeshift. I do have a measuring tool. This is a bookmarker. But anything straight would work. So we're going to come here to where we see these pulsations. We're going to come straight out with our little marker. For her, we're going to measure from the sternal notch. We'll do this. We'll measure from the sternal notch right here. I'm going to measure that. It's approximately 2 centimeters. This is not the best situation or scenario we've got, but it's approximately 2 centimeters, and anything less than 3 would be appropriate. Turn your head back to the middle. Let's do a little bit of palpation. So we're going to be done with our inspection of the skin and all. We're going to move to palpation, and we're going to come in here, and we're just going to move that SCM over a little bit. Palpate the carotids on each side individually, not at the same time. All right, we're going to stay away from up here. We don't want to vagal her down and drop that heartbeat down there and drop her pressure. We don't want to do that, so we're going to do this a little bit lower in the neck. But you can just go inside these sternocleidomastoids, and you can find that in there. It's very easy to find. Our palpation is going to move down into the second intercostal space on the patient's right, and we're going to be able to palpate through the tissue, all right? I'll go back through that in a minute. Through the tissue of the torso, see if there's any soreness. Do you have any soreness through your sternum or upper torso at all?
No.
All right. We're going to go back here. Let me start this again. We're going to go back to second intercostal space where your aortic valve is. We're going to palpate that. We're going to go over here to the second intercostal space on the left, pulmonic. Move right on down to the third. That's your herbs. Move down to the tricuspid at the fourth intercostal. Move down to, would you take your left hand and move your breast tissue up, please? And move down to the fourth. That would be your tricuspid. Move down to the fifth. That's going to be your bicuspid, and we're going to move out to the midclavicular line to go to your apex of the heart. It's right there. Now, I can't feel her pulsations, and that's perfectly fine. But anyway, we're going to palpate that. There's no tenderness. There's no soreness. There's nothing like that that's going on. And so we're going to use those same markers, second on the right, second on the left, third, fourth, fifth, and out to the midclavicular line when we move over here to to do our auscultatory. We're going to do that in just a minute, all right? So palpation now, we're going to move down to the abdominal aorta. I'm going to lift this up. We've already checked the skin. We've got the belly button right here. We'll go about 2 inches or so above that. Just move to a little off of midline. A little bit of a deeper palpation. There's no thrills. Haven't felt any thrills anywhere up above or down below. We're just going to palpate on each side of it. Just to make sure it's all right. And we're going to palpate. When you drop down, you can go straight out to your iliacs. Below that, your renals. Let me get in there. I'm going to do this on one side now because that's where this camera is. We're going to move down into the inguinal area for the femoral. Sorry, a little ticklish. My bad. There we are, right there. All right, down into the femoral. All right, so we've got these. The femoral is palpable. Everything looks pretty good. It's appropriate. Let's see. So when we're done with the palpatory, let's go ahead and do her pulses since we're already palpating. We're going to just start at the top. Would you palms up? Go over here to the radial. Go over here, brachial. We'll do both sides. Well, got your watch on. All right, let's do both sides. All right, we've done these. We've done radials. We've done brachials. We're going to come back here. They want us to do, according to the videos that the teachers gave us, popliteal with 2 hands. I typically do it with 1. There's 1. All right, bring it up. Got it. We're going to go over these popliteals. We're going to move straight down to the posterior tibials. Very simple to find. Dorsalis pedis. Good one. Dorsalis pedis. Good. No clubbing, no cyanosis. We've got nothing going on. We got good capillary refill, less than 3 seconds. Hold your hands out like that. Thank you. Capillary refill, no clubbing. Cap refill is less than 3 seconds. That would be appropriate. Do that on every finger and every toe. All right, we're going to move on. All right, now we finished that. We're going to go ahead and do our auscultation. We're going to start right back at the same spot. We're going to go straight up. We're going to auscultate. Oh, I'm out of the picture. We're going to auscultate with our diaphragm. Then we're going to follow it up with the bell. That's what you can hear the breweries with the best. All right. Let me take this pillow. All right. Thank you. Just relax. Head in midline. Thank you. Good. No breweries. When we palpated, we couldn't feel any thrills down through here. You feel the thrill. So we didn't have any thrills. We're going to go to the second intercostal space on the right. Aortic. Slide over to pulmonic. Down 1 space to herbs. I'm just using the diaphragm right now. Down 1 space to the tri. Good. 5, the bi, and then move out the midclavicular line. Apex, flip it around. Do the same thing with the bell. Follow them right down. Herbs, tri, 5 is bi. All right, we're going to do the same thing with the abdominal aorta, iliacs, iliacs, renals, and then the femoral. All right, bring that up, a couple inches above. And we'll go out, yep. Flip this around. Any breweries? Nope, no swishing, no breweries. We're using the bell at this point. Go back. Abdominal. Iliac. renal. We're going to do that now with our femoral. We'll flip it back around. There it is. Flip that back around. Oh, excuse me. Flip that back around. Use the bell. We'll do that on both sides. Ow. Now, when we're auscultating that stuff, we didn't hear any bruise or anything, nothing abnormal. If you hear something abnormal, you might hear an S2 split. An S2 split's not necessarily abnormal. Let me say that again. An S2 split is nothing more than the pulmonic and the aortic valve, when they should be closing at the same time, creating one sound in that the lub comes first, you're trying by, then comes that aortic and pulmonic. But especially if you take a deep inspiration, it can sometimes split those sounds where they don't close at the exact same time. And that difference is an S2 split. It doesn't have to be pathological. You don't have to get too excited about it. But clinically correlate it with the rest of your patient care. And if you need to, refer them out to the appropriate cardiologist. And if you don't, and it's, you know, it's benign, if you will, then let it go. And so that's what we did with an S2 split. We have good capillary refill and stuff. So we're going to move on. We're going to do these arms and legs. We've already looked for pink, warm, and dry. We've looked for scars. We looked for tar. We looked for capillary refill. And we did our pulses. Now, when we get down to the feet and we get done with the dorsalis pedis, and we've checked everything down here, we're going to do a special test. I think raise your feet up a little bit. Yeah. Here, we'll just do it like this. We're going to do a little special test called Holman sign. You dorsiflex the foot. You reach around. You can squeeze that calf area, right? And that calf area, do you have any pain, tenderness?
Nope.
All right. Do that on both sides. I'd be around the other side of the table doing this, but this is the best we can do for right now. All right, I'd be doing that, all right? So again, no varicose veins, no nothing like that. So that's where we went through our inspection. We did our palpation. We did our auscultation. We did our arms and legs, right? And we did the test for the Holman sign. That's my cardio exam, and I'm going to send this video in. Thank you.